There has been much discussion over the usefulness of particular diets for cancer patients and their potential benefits. The discussion is crucial considering that numerous studies on the subject indicate that cancer cells typically need on specific types of food to thrive, such as cancer cells that are ravenous for sugar in order to grow glucose as tumors. Many methods and studies suggest that nutrition can block the progression of cancer or even reverse it in some situations. PET scans use a special type of sugar that is injected into the patient's bloodstream to locate various malignancies in the body. The foods we provide our immune system determine how well it functions. In many cancer patients, a carefully designed diet of natural foods could be life-changing. Having a balanced diet, staying active, and being aware of the vitamin-rich foods, antioxidants, and minerals will help you stay healthy. It's crucial to understand which meals are good for your overall health and may lower your risk of developing cancer. Number 1, berries, because they are rich in antioxidants and vitamin C. Antioxidants have been shown to shield the body from all forms of cell deterioration. In lab experiments, berries also had a substance that fights lagic acid. Lagic acid appears to have anti-cancer effects that activate enzymes that obliterate cancer-causing agents and inhibit tumor growth. Number 2, broccoli, along with cauliflower, cabbage, and kale, contain significant components that studies suggest can shield the body from stomach cancer, mouth pharynx larynx, or esophageal cancer. There are studies that provide reliable evidence that increasing consumption of cruciferous vegetables, broccoli, cauliflower, cabbage, and kale, can reduce the risk of cancer. Sulforaphane, which is abundant in broccoli, may have anti-cancer properties. One study found that sulforaphane can reduce the size of breast cancer cells by an impressive 75%. Number 3, grapes. Resveratrol is a form of natural phenol produced by plants and microorganisms, and it has been the focus of extensive research into how it affects human health and disease. Some studies have suggested that it can prevent breast, liver, or lymphatic cancer. 4, tomatoes. Lycopene, an antioxidant that gives tomatoes their distinctive red color, is thought to be responsible for preventing prostate cancer. The 5th, carrots. One substance that carrots are most famous for is beta-carotene, which also gives them their orange color. Recent studies have demonstrated a critical relationship between a daily consumption of beta-carotene and a strong immune system. Carrots are also rich in vitamin K, vitamin A, and antioxidants. The 6th, walnuts. Studies on walnuts' potential to prevent cancer have been led by the American Institute for Cancer Research. When it comes to cancer research, walnuts are the nut that is most heavily studied because they are high in peduncle again. Our bodies convert this molecule into urolithin, which binds to estrogen receptors and may significantly reduce the risk of breast cancer. Number 7, legumes. Numerous studies have been conducted to determine the ability of dietary fibers to lower the risk of cancer. A recent analysis of 14 studies revealed that high legume consumption can lower the risk of colorectal cancer. There is also high anticipation that people with a diet rich in bean fiber are less likely to develop breast cancer. Number 8, fatty fish. There's nothing you can't appreciate about salmon, mackerel, or anchovies, and you're right to believe that. Nevertheless, you might also be pleased to learn that fatty fish are rich in a variety of minerals, including vitamin B, potassium, and omega-3 fatty acids. Fish eaters had a 53% lower risk of colorectal cancer. In addition, a study found that those who took fish oil supplements at least 4 times per week had a 63% lower risk of developing colorectal cancer in the future than those who did not. Number 9, apples. The adage 1 apple a day keeps the doctor away may not be too far off the mark. Apples contain a substance called polyphenols that may have promising anti-cancer properties. There is strong evidence that polyphenols can prevent various types of inflammation, cardiovascular disease, and other infections, and there is optimism that they can also combat cancer and tumors. In 2018, a significant study published in the Journal of Food and Drug Analysis demonstrated that apple florida can inhibit the growth of breast cancer cells without having an impact on healthy cells. Number 10, garlic. Garlic contains an active ingredient called allicin, which is recognized by experts as a cancer cell killer. Studies show that when you foods such as garlic, onions, and leeks can reduce the risk of developing stomach cancer. An additional encouraging investigation with 471 men revealed that increasing your intake of garlic can lower your risk of developing prostate cancer later on. Number 11, flaxseed. Flaxseed is always a good idea when discussing healthy additions to your daily diet, and recent studies have shown that it can help prevent the development of cancer and even kill cancer cells. In addition, a study involving 32 women with breast cancer found that a significant dose of flaxseed can reduce the spread of the tumor and cancer cells. Also, in another study, flaxseed was used to treat 161 men who had prostate cancer, and the results were quite positive. 12 citrus fruits. One study found that those who ate a lot of citrus fruits had a lower risk of acquiring digestive kinds of cancer. The most popular citrus fruits are limes, grapefruits, and oranges. They're quite healthful and delicious. The conclusion is that you should include a few servings of citrus fruits in your weekly diet to reduce the risks of acquiring certain types of cancer. A high intake of citrus fruit of at least 3 servings per week can reduce the risk of stomach cancer by 28%. Despite the incomplete studies and the fact that it has not yet been fully established, there is still much optimism. 13. The spice turmeric contains curcumin, a highly potent compound with antioxidant, anti-inflammatory, and even anti-cancer properties. For instance, when 44 patients with colon lesions were given 4 grams of curcumin daily for 30 days, the number of lesions was reduced by 40%. Turmeric. 14. Olive oil. Before claiming that olive oil can actually treat cancer, there may be other factors involved in this correlation between olive oil and cancer reduction that should also be taken into consideration. However, there are still high hopes in this regard. Olive oil is already well known for its health benefits, which may even help protect against cancer. 15. Dates. Antioxidants found in dates, such as flavonoids, phenolic acid, and carotenoids, have been shown to have anti-inflammatory and anti-cancer properties in some studies. However, more research is needed to fully understand the potential cancer-fighting effects of dates and to determine the optimal amount and frequency of consumption to obtain any potential benefits. While there is no guaranteed way to prevent cancer, incorporating a variety of nutrient-rich foods into your diet can have a positive impact on your overall health and potentially reduce your risk of developing cancer. It's important to remember that a healthy lifestyle involves more than just diet, and factors such as regular exercise, maintaining a healthy weight, avoiding tobacco and excessive alcohol consumption, and getting regular screenings and checkups are also important in reducing the risk of cancer. If you have any questions or comments, feel free to leave them below. And as always, make sure to consult with your healthcare provider before making any significant changes to your diet or lifestyle. Thank you again for watching, and we'll see you in the next video.